Nothing wrong with you when you take Viagra. It can, worst case scenario, give you a heart attack and kill you.
Yes.
If there's something wrong with you and your heart is not healthy, and we give you the ability to do what you should not be doing,
Yes.
you can have a heart attack and it can kill you. If you take it when you're not supposed to you can have and even when it's prescribed, you can have a prolonged painful erection,
Okay.
which we call paraplegia. Well, if you're over 40, up to half of the male population can
serious?
have erectile dysfunction.
No.
When you take your blood pressure medications, you improve the health of your heart and you improve the health of your vessels.
Yes.
So just in the short term, yeah, your pressure is going to drop a little bit. But in the long term, you're going to have more preservation of your erection.
Okay.
And you don't take those medications, and yes, the erection is there, it is going to go away quicker than if you took those medications. And you know what is not good for erection? If you're dead. If you're dead, you cannot use it. Or we give any of those tablets, we have to make sure the patient's heart can tolerate what we're giving them the ability to do.
Okay.
Because I'm sure people who are listening have heard of unfortunate incidents happening mid coitus.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. In Office is a program which we discuss life, sickness, and death. And today in office with me is the Dr. Mars. She's a consultant urologist here in Jamaica. Welcome to the
Thank
show,
you so
Dr.
much for having me.
Sure. All right. So I guess here studied at her first degree at the University of the West Indies, and then she went on to specialize in urology at the University of the West Indies, where she also studied to some extent doing an elective at the University of Toronto in Canada. So she has both local and overseas experience in both the urology and general medicine area. Now, today we'll be discussing in particular erectile dysfunction. Before we get into the discussion, however, I want Dr. Morris to just enlighten us on who is a urologist and the different diseases that they manage. Okay. Yes, Dr. Morris.
So a urologist is a surgeon. So any disease that will affect the kidney, the tubes that drain the kidney,
Yes.
the bladder, the male genitalia, the penis, the scrotum, the testes, all of those things, if there's anything surgical to be done,
Yes.
we will be the doctors managing that. So kidney stones, prostate cancer,
Yes.
erectile dysfunction,
Right.
testicular cancer,
So-
anything
Okay.
in those areas.
All right, good. All right, so let's jump straight into the topic for today. So, erectile dysfunction. What is erectile dysfunction?
So basically,
I'm just sorry to cut it, but remember that this is for the general public, so I have to use simple terms now. We don't want to get technical, so my dad can't understand. All right, good. So, what is erectile dysfunction?
so if your erections are functioning normal, you'll be able to get an erection,
Yeah.
get an erection that is strong,
Yes.
get an erection that you can introduce into the vagina to start having sex, and have an erection that will persist for the entire period of having sex. So if any of those areas is not working the way it should,
Yeah.
that would come under erectile dysfunction.
Okay. All right. So, erectile. So that's a good definition or understanding of it. But how common is erectile dysfunction?
Well, if you're over 40, up to half of the male population
You
can
serious?
have erectile
No,
dysfunction.
I don't.
Yes.
I'm almost 40.
Some degree of erectile dysfunction.
Tell them say up to 50%.
Up to
50% of
yeah.
males 40 and above
Yeah,
have some
can
degree.
have some degree of erectile dysfunction. And the way to look at it is for the erection to work, yeah, the vessels have to be intact, the nerves have to be intact, and the hormones have to be intact. And as you know, based on your day-to-day practice,
Yes.
as you hit 40, your diabetes, your high cholesterol, your hypertension, metabolic syndrome, all of those things start to increase too.
Okay.
Start to have more health problems. So along with that,
Yes. So what are some of the main causes of erectile dysfunction? So you mentioned generally the vessels, but in terms of like the risk factors and what are some of the main causes?
so there's a lot of causes, but I want to focus on what we investigate for most commonly
Yes.
and what is of greatest concern.
Okay.
So when we're thinking about erectile dysfunction, as people, when we're thinking about the penis, we have to remember the vessels are very, very small. The
Okay.
other area that has those small vessels, and I'm putting this here because I want people to really take it seriously,
Okay.
because it's not only about your ability to have sex, but your ability to live.
Okay.
Because your heart has vessels that are really, really small. And a lot of the time, if something is happening with your blood vessels, the first place it shows is in your penis.
Okay.
So when a patient comes in, we have to take a very detailed history.
Okay.
It's interesting, if you hear us in office, it would sound as if we're investigating a lot of medical conditions, etc. But it has to be very detailed because we have to think about, is there anything that's a hormonal indicator? Could they have low testosterone levels? Or are they at risk of having high cholesterol? So patients with high cholesterol, even before they come into the office when we do the vitals, do you have high blood pressure?
Okay.
Do you have a history of diabetes? And those are the main things that we look for initially. We also look at stressors. Stress is a big deal.
Yeah.
And it's not, people like to say it's not mental, because stress affects your hormones, it affects like things like adrenaline, and those things affect your blood vessels. Smoking is a big factor too. If you're a smoker and you're otherwise healthy with nothing else happening, you're 1.5 times more at risk of erectile dysfunction. Yeah, just smoking alone.
Men are listening, because men tend to smoke. What about drinking as well?
Alcohol.
Alcohol.
Yeah, if you're a sedentary, so you have to be eating healthy. If your diet is poor, if you just sit down all over the place and you don't exercise, you don't move, it's a death to your penis.
And obesity as well. I believe obesity is a strong risk factor. All right. Now, I know I mentioned a few stuff. Some are modifiable, but they have some risk factor like older age. Those guys tend to have erectile dysfunction as well.
Right.
But sometimes when I know that I'm mainly dealing with medicinal patients and high blood pressure, and sometimes when I'm giving the patient complications of high blood pressure, and I'm telling them about that one of the complications of uncontrolled high blood pressure is erectile dysfunction.
Mm-hmm.
The patients want to say, but the medication that they're giving for the high blood pressure, especially the diuretic and the beta blocker, the Carvedal and so forth, they're really not going to take them. Some patients refuse from take them because it actually worsening their erectile dysfunction or causing it in the first place. How do you normally address those patients?
Okay. I don't want to just say that it causes it in the first place, because the high blood pressure means that there's something wrong to begin with.
Okay.
So yes, when you take your high blood pressure medications, yes, it can affect the erection, but it is better in the long run. Because when you take, and you probably be able to explain this more than me, when you take your blood pressure medications, you improve the health of your heart and you improve the health of your vessels.
Yeah.
So just in the short term, your pressure is going to drop a little bit, but in the long term, you're going to have more preservation of your erection.
Okay.
And you don't take those medications, and yes, the erection is there, it is going to go away quicker than if you took those medications. And you know what is not good for erection? If you're dead. If you're dead, you cannot use it.
All right, that's a good one. All right. Now, some other factors that I see at my office commonly, the persons who, I know that you probably remove a prostate every week, at least one every week, all right? But those patients normally come to like my private office and they have erectile dysfunction. It's very common, after they remove the prostate, that they remove the prostate entirely, they have erectile dysfunction. And for some of those patients, normally at my office, I gotta do mainly GP work. I normally will just give them some Viagra or Cialis, etc. And sometimes I find out that those persons that have that remove the prostate, the Viagra tend not to work as well as some of the other patients. You want to just explain that process in simple layman terms, why that's the case.
So unfortunately, all of the treatment that we use for prostate cancer to save your life affects those nerves. And for the surgery in particular, it's because those nerves are plastered right on the prostate. So however you're dealing with it in terms of surgically, you have to look for the nerves and peel them off the prostate. So you're going to have some degree of damage.
Okay.
But a rule of thumb is the better you have before is the better you have after.
Okay.
And for sure, sometimes it's more significant, especially if your disease is more advanced, especially if you're an older patient, especially if you have other things like high cholesterol, diabetes, high blood pressure, all of those things, for sure it will affect it. And part of the reason why the Viagra works in some, but not all, is because there's actual nerve damage.
Okay.
In addition, if you're treating with things like radiotherapy or hormones to assist with the treatment of prostate cancer, that can affect the blood vessels too and the blood supply too. So the Viagra or the Cialis or any of those drugs have much more work to do.
Okay.
But there are other things that we can do aside from tablets. But we generally start off with the tablets to begin with.
Okay. All right. And before we get into the treatment of erectile dysfunction, I know there are several different treatments. Just wanted to like you to give some experience of like some of the psychological and emotional distress that males have when they're having erectile dysfunction, like relationship problems, because up to since recently, like a patient came to my office and he was actually basically suicidal because he's unable to have an erection. So even though erectile dysfunction itself is not gonna really necessarily kill the person, it's actually basically if a man cannot get an erection, it basically he can be so depressed and even become suicidal. But in terms of your experience, because you would have seen me seeing these patients in way larger numbers than the two or three that I would come across. There are some of the major challenges that they have apart from just that the penis is not working, but how it's affect their lives with their partner, confidence, and overall health.
So I thank you much for that question. So generally, if I have a patient who comes with erectile dysfunction, sometimes they don't come with erectile dysfunction at all. Too, it's towards the end of the appointment they kind of mention it. It tends to be a longer appointment because there's a lot of non-hands-on discussion happening. It's always good if they can come with their partner. So even when they come through the door, if I know they're coming for erectile dysfunction, I can get an idea of the landscape. Are they there with their partner?
Okay.
Because not all partners are as supportive as we would like them to be.
Okay.
And I do have patients in the practice who, unfortunately, their relationships have broken down completely
Okay.
because of erectile dysfunction. And a lot of these patients are cancer patients too.
Okay.
And it breaks down completely. It's stressful for the man and it is also stressful for the woman.
Yes.
So first off, you need a supportive partner.
Okay.
Regardless of what train of treatment you're going to be getting,
Yes.
you need a supportive partner. And it sounds interesting that the surgeon will be talking about that, but that is part of the management.
Yes.
You need to know how it's affecting the patient primarily, obviously, his well-being, how he's able to navigate his life.
Yes.
Some people can be very cruel, but even if you do have a supportive partner, sex is important. Sex is important. Whether or not you belong to an organized system or religion or not,
Yes.
it is an intimate thing and it's an important part of a relationship.
Yeah.
And if you can't partake in what is important in a relationship, it's gonna affect the relationship.
Definitely.
And if that relationship is important to you, it's gonna make you feel sad. There are some patients who I have to give additional medication to help their mood because they can become significantly depressed, and it's a big deal.
Yes,
It is a big deal. And even in my practice, you have to look. I know more importantly with internal medicine, etc., you'll be more looking at, but even with us, we have in the back of our mind markers for depression.
Okay.
And little screening tools and questions we will ask
Okay.
because men's mental health
Yes.
month just finished.
Yes.
It's important that we do manage the mental health of men,
Definitely.
and there are so many other stressors outside that to add this additional stress can be quite significant. So yeah, we have to talk to the patients, listen to the patients, and watch out that there isn't any progression into depression.
Okay. So normally, so in the general management of the patients with erectile dysfunction, we normally refer them to psychologists or psychiatrists as well sometimes, or
Sometimes, not all of them. I do have some patients who have erectile dysfunction that I kind of end up being a sounding board and a psychologist in the room.
Okay.
But yes, there are some that I have referred to the psychologist.
Okay. All right. All right. I know this one. I don't really want this session to be a drawn out session. I just want to get to the point. But in terms of, we can look at some treatment, all right, for erectile dysfunction. You just want to give us a brief overview of the different treatment modalities, and then we ask the specific questions about these, because I'm particularly interested in one of them. All right?
Okay, so we can start off with tablets that we can take that increases the blood supply to the penis.
Yes.
There's what we call prostaglandins that we can inject directly or put to the penis. And there's also penile implants.
Okay.
Before we get to penile implants, there are also things like vacuum devices
Okay.
and rings at the base of the penis, things like that. But even before, and I just want to reiterate, I know it's interesting because as a surgeon,
Yes.
you're like, let's get to the cutting.
Yeah.
No, we have to treat the underlying cause.
Okay.
So we even start with, just as you said before, not being obese, exercising, not smoking, decreasing your alcohol intake, because the new data is showing that there's really no safe amount of alcohol, eating the rainbow, a healthy life, and managing your diseases. Like if you do have hypertension or diabetes, managing those things.
Okay. All right. Now, I've seen probably about one patient with the, I think, prostaglandin injection, I said, with penis. But what are some of the pros and the cons of the prostaglandin? All right, let's just do pros and cons for the tablet first.
Okay. So before we give any of those tablets, we have to make sure the patient's heart can tolerate what we're giving them the ability to do.
Okay.
Because I'm sure people who are listening have heard of unfortunate incidents happening mid coitus, but we have to make sure. So it starts with just history. Are you able to walk up a flight of stairs comfortably? Do you have any chest pain? Do you have any calf pain? Are you always short of breath, etc.? Because these, if you take them inappropriately, if there's nothing wrong with you and you take Viagra, it can, worst case scenario, give you a heart attack and kill you.
Yes.
If there's something wrong with you and your heart is not healthy, and we give you the ability to do what you should not be doing,
Yes.
you can have a heart attack and it can kill you. If you take it when you're not supposed to, you can have and even when it's prescribed, you can have a prolonged painful erection,
Okay.
which we call paraplegia for the Greek buffs out there.
Okay.
But and those things can affect that with the tablets. With the direct injection, every time that we disrupt the skin barrier in anybody, there's a risk of infection. There's also the risk of the prolonged painful erection with that too.
Yeah.
And those are the primary risk factors. And occasionally, when you take these medications, the tablets like sildenafil, which is the Viagra, tadalafil, Cialis, etc., you can have a mild discoloration in your vision, which goes away.
Oh.
And it's fine. And you can just switch to a different type.
All right. Normally, the injection.
Mm-hmm.
Normally, the patients that in the injection, sometimes it's not convenient for persons that probably tend to travel a lot.
Mm-hmm.
And then some persons, because I know the one person that I knew was on the injection, that's just one patient. He also has diabetes, and he's really planning to stop the injection because he's more fearful of the injection with the penis than injecting himself every day with insulin. So how does that injection process work? Is that a similar thing to like administered insulin, or you have to go deeper in the penis?
So within the penis, you have pretty much 2 cylinders that's covered by tissue, and those cylinders get filled with blood and get hard. So the injection has to act on the blood vessels. So you get a tiny, tiny needle, but it has to be long enough to get into the areas that has the cylinders. So yeah, it's definitely deeper than the insulin injection.
Okay.
Yeah, and it, especially in our population where we don't like needles. I myself hate a needle, but so we get the patient into the office and we practice with them and show them and we observe them.
Okay.
But yeah, it's a decent depth.
Decent depth. Okay. Right. Now, the one that I've seen with one patient that I was having a discussion with you, and I wasn't really aware that actually it in Jamaica is the implants for the penis. You want to elaborate on that to let the viewers know about that option?
Right.
Because until recently I didn't know that was available.
So we have had implant surgeries available for years. The person I do surgery with, my surgical partner, she does them a lot, and I operate with her.
Yes.
Dr. Tasha Cook.
Yes.
And we've been doing them for at least over 10 years.
10 years.
The limiting factor, though, has always been the cost. The implants, and erection cells, sex cells, and those implants, the device itself will cost up to $10,000 US.
10,000 US. Oh.
Right. And up until recently, insurance didn't cover that.
Oh.
But over the past few years, insurance has started to cover more of it. So we're doing more and more now.
Yes.
It's again it's a beautiful device.
Yes.
I know people will be surprised to say that. It's a beautiful device. It's very specific with the surgeon. You have to be very careful about infection because it is something that is going to live in your body for about 10 years if it works well. But the good thing about it is, well, you have different types. You have one that is semi-rigid. So there's always fullness all the time.
Yeah.
And when you're ready to engage in sexual activity, you kind of just straighten it and continue.
Okay.
But the one that we do most is an inflatable implant where it has two cylinders that go in the cylinders that are already in the penis.
Yes.
You have a little reservoir for water, and when you're ready, there's a very discreetly placed pump. Unless somebody is face up to your scrotum, they will not be able to see it.
Yes.
And presumably, if they're that close, you already have that level of trust. And but even if you don't want to share with the partner, you just discreetly
Yes.
inflate it, have sex, have your orgasm, and you press a little button and it goes back down.
Yes.
So, in a lot of instances, you could have sex and nobody would know.
Yes.
Well, they would be impressed by your prowess, but yeah.
Yeah, because that's what the patient was telling me, that because he was like about 70 something years old, and he was telling me like with this device,
Mhm.
it's like the erection will stay as long as he wants.
Yep.
And I was like, so
Yep.
I was wondering, like, is the first patient I've ever seen which have erectile dysfunction issues, and the treatment was like he was 100% satisfied with the treatment, like unbelievably.
Yep.
He was 70 plus. He said he performed like better than when he was a teenage, but he was in
Yes.
his 20s.
Yes, because there's no effect if whether or not you're diabetic or hypertensive, etc., those cylinders work unless they fail mechanically.
Oh,
And then when we put the device in, we check the length precisely so it fits. Each device is to the length of the penis that you have, and we check how erect it is, the turgor, how it's positioned, the angulation, all of these things to get the best erection possible. You know, so we're trying it in the theater to make sure everything is fine when we're in the operating room. So yeah, aside from mechanical failure, I've never seen a patient who has been upset with the result.
okay.
Of course, things happen because it is surgery and it is a device, but the most important thing is to find somebody who knows what they're doing because it
Okay.
is specialized surgery.
Yes.
But sometimes the device fails. The company that we use locally, though, if the device fails, they will provide a new device, which is reasonable for that price point anyway.
So have you noticed like the decrease in cost for it over the years, or is it getting more expensive? Because I'm saying that if this device was like more affordable, then I think it would solve a lot of older male problem, main problem, you know.
You know what? Of course, if it was more affordable, but you know, companies are very efficient at making money. They're not going to decrease it because people will find the money to spread it.
Okay.
But it has become more affordable because the insurance companies have been encouraged, pressured. But what I will tell you is the prices haven't been increasing.
Okay.
So there's that. Admittedly, though, when you start off at that high price anyway, there's really not much more you can go.
Okay.
But yeah, but it is more affordable to John public because insurance is helping them.
Okay. Okay. All right. Yes.
Sorry, one more thing
Yes.
that I didn't mention, and we really should, because in our population with a parasitic sickle cell disease, a lot of our patients will get erectile dysfunction if they have a lot of parasitism. So the painful erections, they come into hospital. So if this happens to you, don't stay at home. Please come to the hospital quickly. And also the sickle cell disease will affect the testes to and decrease testosterone.
Okay.
So we have a little bit more of that. If you read the textbooks, they'll just have it down the bottom of the footnote.
Yes.
But here in Jamaica, because we have so many people with sickle cell disease and sickle cell trait, up to 10%.
Yes.
Collectively, we see a lot of that too.
Okay. All right. Some persons I'm seeing using like these herbal stuff, and they're saying they're getting good results from these herbs, right? But because I'm not really trained in the herbal area, I'm telling them that I can't really advise them on using her herbal medicine for erectile dysfunction, but some of them are so pleased that it works better than the pill. What's your take on the herb, and if you have any idea of persons that do these herbs?
Well, the problem with those herbal supplements, well, it's not, is that a lot of people are still adding the Viagra or the same medication to it. The difference is we don't know exactly how much they have added in each little capsule or each little container of whatever you're using, and that's the real issue. So they're using the same drugs in a lot of the herbal medications, except that one is packaged with a specific amount and can be held legally accountable if something happens, and the other one isn't.
Oh, all right. So a part of this program, we normally give the guests a chance to advertise their practice. It is a doctor, and but before we go into like advertising the practice, I just wanted to just give a summary of erectile dysfunction that we have discussed today. So for who probably just joined, can just have an idea
Okay.
of the summary.
In summary, we need, if your erections need to be strong to start, strong to put into the vagina, and strong to continue. But to do that, we have to focus on overall health. Very, very importantly, you eating right, you're exercising, no smoking, very minimal alcohol. Go to your doctor every year, check your numbers, watch your numbers, because anything that we catch early, check for your prostate too, because the earlier we catch anything, the better we can manage it. If your healthy lifestyle is better, and regardless of how much erectile function you have, there are options available locally, including the penile implant.
All right, Dr. Mars, well said. And now I'm going to give you a minute or two to just tell the viewers where to find you at the office if they want to get this penile implant or more advanced treatment than just the Viagra and Cialis. You can contact the specialist, all right?
Okay.
Tell them where to find.
So I practice in two parishes, St. Andrew and St. James. In St. Andrew, I'm at 22 Windsor Avenue, at Windsor Wellness Center. And in St. James, I'm at the US building at WJUS, Western Medical Specialists. I'm gonna ask Doc if he can include the numbers.
Okay.
I'm not so great with the numbers.
Okay, no problem. You can send me
What?
the flyer or the business card and I'll add it to the
Wherever you are in the island, you can find me.
Good. All right. Okay, Dr. Mars, I'm very thankful that you have taken this time out of your very busy schedule to come and be a part of my promotion. It's a health promotion program, and definitely I know that at least one person will benefit from this session today. And continue the hard work and continue the love that you have for your patients and health promotion, and you're doing very well, and I'm very happy that you could come and join me on this program to make life better for at least one person in the world. All right?
Thank you so much. Thank you for having me.
Sure.
Be sure to subscribe for more informative contents on life, sickness,